Welcome back to the Dr. Medispa channel. I'm Dr. Solomon.
Somji skin.
Oh, Dr. Somji
Yeah,
skin.
we changed it. Yeah.
Oh,
yeah.
fine.
Yeah,
Okay.
that's fine.
Welcome. Welcome back to the Dr. Medispa. Welcome back to the Dr. Medispa series. Welcome back to the Dr. Medispa series. I'm Dr. Solomon.
And I'm Dr. Somji. Today we're going to speak about something that has been in our medical group amongst our doctors for a really long time,
Yeah.
and people are actually messaging us. Some of them are actually quite concerned about this because it's a serious issue actually.
And that issue is, does filler cause bone erosion?
Yeah, does filler cause bone loss? This was a study that was performed looking at patients between year of 2016 and 2018, and it was like just a chance discovery. They had 9 cases of patients that were doing preoperative CT scans before implants. So these are patients that wanted a chin implant to bring the chin forward.
Something we commonly perform.
Something common perform, and you do it in a non-surgical way when you inject filler into that area. Now, just as a, let's say like a side thing, when people are injecting like 4 or 5 mils in this area, I've never agreed with it. I've always done it slowly over time, just because as a doctor, I always think a cautious approach is better. But this study basically showed that all of those 9 patients had 1 to 3 injections between 6 to 12 months apart, so kind of 1 to 3 mils within the chin area before having essentially a chin implant.
Yeah.
Okay, and what the preoperative CT scans found, that within the incisive fossa, so in this area, in the chin area, that there were some evidence of bone resorption. So that meant that there was evidence of bone erosion within that area, and they did certain staining to have a look at it. Now, it's only 9 patients, right, at this time period. So when we looked at this study, we said, well, look, it's a very small number of patients. They've had numerous filler treatments in the past, and look, there's a reason why they need a chin implant, because actually they probably did have some bone erosion. So we couldn't attribute it to the filler. So there's now been some new studies, right?
There is another study that was a follow-up to this study, which was published in 2020, so actually the year of the pandemic. And it looked at 160 patients. They took 160 patients, they divided them into 2 groups of 80. 80 of them had chin filler, again, something we commonly perform in clinic. And the average amount of filler injected was 1 mil, which is a standard amount that we tend to inject in the chin to essentially create a gel-like artificial chin implant. And they took another group and they just injected water, essentially. So there was no filler injected, but the patients were blinded to what they were having injected. They then followed them up and they found that the group that were injected with filler had a significantly increased number of osteoclasts, so bone resorbing cells or bone loss cells, and evidently on scans, less bone in the area.
So let's just take this back, because obviously you've got 2 cells that essentially maintain your bone health. So you've got osteoclasts and osteoblasts. Osteoclasts essentially take away bone, so bone turnover, and osteoblasts are involved in creating new bones.
Building bones.
So when we get older, the balance between your number of osteoblast activity and osteoclast activity is into resorption, i.e. clasts. So there's more osteoclast activity than there is blast. So in this specific area, it turned the tide, right?
It did. What was interesting is that whilst there was evidence for the bone loss, it wasn't aesthetic, so you didn't actually see that bone loss.
Exactly.
And they retained the aesthetic appearance of the chin filler, but when you looked at the scan, there was actually bone loss there. So is it significant? We don't know. The jury's out on it.
No, I mean, we don't think it's significant, but obviously there's evidence of bone loss there. So I think the answer to the question is yes, both fillers can induce bone loss. But I think that people shouldn't really be getting worried, because hyaluronic acid itself does generate its own collagen. What is bone made up of? It is made up of collagen. But I think there's a few important factors here that we actually already have been doing for our patients for a number of years.
Okay, tell me about them.
So I inject less. So when I inject the chin area and I'm doing profile, if I'm injecting someone's lips, I'll inject maybe 0.1, 0.2 mils in there. The study showed that when you're reaching levels of kind of more than 1 mil in a sitting, that's where the issue and that's where the risk is. So the pressure induced effects on the bone can help break that down. So if you inject smaller amounts over longer periods of time, then you'd be absolutely fine. And that's the way that I've always adopted everything at the clinic, is to start low, go slow. So that's one thing. And then secondly, with people with very tight mentalis muscles, so that in that area, which they tend to have if they've got smaller chins, we always put Botox in there to relax the muscle. So you basically relax that area and allowing the filler not to have so much pressure within the area, and that then will not break down the bone as much as well. So that's another strategy that we use. Now, look, the main thing from the study, which you've correctly said, is that there's no aesthetic difference. So in terms of a volumetric analysis, there's no changes. In fact, some of the, if you look at this, some of the things that actually said that there was an enhanced effect there. So actually, yes, it's still going to help with your appearance. But what, and I think that, you look, there's so much bone there. You're never going to have a problem with that, right? In terms of losing bone in that area.
So for the time being, it appears to just be academic. It appears to be just an interesting academic finding. It doesn't seem to be relevant clinically. It doesn't seem to change the appearance. What's really important is both studies found that there wasn't bone loss elsewhere, with filler injected elsewhere. So a lot of these patients that were recruited had filler elsewhere, and when they were scanned,
so like cheeks,
mid-face.
So like one of the things they talked about is injecting both filler at a higher depth, more superficially. But I would exercise caution with that, because when you're injecting quite superficially in the chin, you're going to get lumps and bumps. You're going to get contour irregularity. When you smile, it's going to look weird.
And it may migrate.
So you know, any injectors, any doctors watching, thinking, yeah, let's inject superficially. You know, I've been there and tried that in that area, and it never really sits very well. So I think that just injecting small amounts over time is really a good strategy. Relaxing the muscle over the top with Botox, and then, like you said, injecting polynucleotides. So polynucleotides are the new injectable that everyone's talking about. We've done a separate YouTube video on polynucleotides, and they can regenerate that process, so they can enhance osteoblast activity, so to tip it back into the favor. So it will help regenerate some bone within that area, and there's significant evidence both in animal and human studies to show that this actually occurs.
And it actually emphasizes a point that we always try and sort of communicate to everyone, that treating certain areas of the body is not just about one treatment, it's multimodal. Combining treatments together is how you really want to achieve long-term, beneficial, aesthetically pleasing results. Yeah,
so like I think if you're looking at treating the chin area, you would probably first treat with some Botox, you do the filler, and then after the filler has settled down, you'd inject polynucleotides within the area, and again, of course, over the face, because it gives a nice result. And also think, if you don't have access to polynucleotides, then think traditional methods such as PRP and PRF that do stimulate bone production and reduce bone resorption can also be used too. And we've been using PRP for years now.
And we actually have another video about PRP as well. So if you want more information about that, if you're interested in PRP or PRF, have a look.
Yeah, absolutely. So look, here's a conclusion. It's quite evident in the chin area that some bone resorption does occur with filler, but if you've been going to an injector that's really sensible and not injecting 4 or 5 mils in a go in the chin area, I don't think you've got anything to really worry about. If you've been limiting up to 1 mil per session, been doing a little bit of Botox relaxing as well, and if your doctor's really into regenerative medicine, which everyone should be into regenerative medicine, add some polynucleotides in there, start healing the area. So these are some of the proactive things that you can do, rather than saying, you know, it's really bad. Because don't forget, you know, we've had patients more than a decade having these treatments into older age as well, and having no problems whatsoever. So like with anything in life, take it easy, don't overdo things, and also make sure that you see your doctor for your reviews as well.
Absolutely. So I hope that answers your questions, and don't forget to click like and subscribe. Click on the notification bell to get notification of future videos that we're going to make and we are creating for you. And if you have any other questions, drop them in the comments below and we will produce those videos for you and answer all your questions, hopefully.